Hi, Dr. Vihn. How are you doing?
How are you?
Thanks, sir, for letting me say a little piece there before we get to you. Dr. Don Vihn, MUHC infectious disease specialist, and a real MVP around these parts. Okay, so let's just talk about the situation in the hospitals. What are you hearing? Give me the latest.
Well, as you know, all the hospitals across Quebec are being stretched, to meet the demands that are going on, both to take care of patients who are on the outside, the outpatients, but also patients who require to be hospitalized.
And what can we add to this discussion that continues to move forward on masks? We've heard California now advising people to wear these homemade masks, and we don't seem like we're there yet. There's a concern about having enough protective equipment. Is the medical community evolving on this, Don?
So this is a very it's become a contentious topic of late, as you just mentioned, right? If you go with what has been recommended before, it has been that masks. So we're talking about here medical masks. So masks that are certified to be used for medical purposes should be used by medical personnel. And regardless of what's going on right now in the news, I think that message is still the same message. Mm-hmm. So I'll give you an example of what the major issue is, right? People in the public who have absolutely no, responsibilities at the medical level and the care of other patients are wearing masks, medical masks in public. That we know, right? Mm-hmm. And as we also know that there's this global shortage of medical masks, such that healthcare workers are not able to access masks. And I can tell you, I've been personally in that situation. And so you're not properly equipped to be able to care for these patients. I'll give you an analogy. Would we ever send our military to the front lines of a war without bullets?
We wouldn't.
Because that's kind of the parallel that we're dealing with right now. When we talk about risks of COVID, we're actually talking about at least two categories of risks. Okay, the two big ones are public and healthcare workers. Okay, let's say the public average risk for COVID is X. We'll just call it X, okay? Healthcare workers who are dealing with patients with COVID, their risk is up to 4X. So 4 times the risk of the public. So we know, based on what happened, not just in China, but in Iran and Italy, and what's going on in the rest of the world, not from just COVID, but from previous coronaviruses, is that healthcare workers are one of the major categories of the major demographics that are at risk for contracting the infection. Why? It's very obvious. We're within 6 feet of a patient. We have patients who are symptomatic. They have disease, and so therefore they're coughing up a lot, and they're coughing up more virus every time they cough. And we know that if a healthcare worker spends as little as 10 minutes with a COVID patient, that's enough to put them at risk. Okay. Mm-hmm. Now, just to put in perspective, for the public to be at risk for COVID, you have to be in close contact with somebody who's symptomatic. So that usually means a few hours, okay, with somebody who's symptomatic. If we sort of use the analogy of sort of like tuberculosis, okay. So we're already talking about 2 different settings, 2 different risks. Now you put masks into the equation and you say, okay, can masks protect us? And the answer is yes, but at different degrees of protection, based on a variety of factors. So how good are masks? How good are masks, right? People want to know, if I wear a chiffon over my face, is that protective, right? So the medical masks, just to let you know, this has been looked at quite extensively, and we know that individual measures such as a mask alone or hand washing alone or those sort of things, they'll decrease a healthcare worker's risk of getting infection by as much as 70%. Mm-hmm. So we start off with 4X, and you do a mask alone, you can actually decrease the healthcare workers to a third of that, so 1.2X. So you're still at higher risk than the general public. But remember, healthcare workers don't just wear masks when we take care of COVID patients. We wear a mask with visor, with gowns that are either fluid resistant or impermeable, with gloves that we know how to put on and discard and wash our hands. There's a whole kit of what we call personal protective equipment that healthcare workers wear when we go and risk our health to go see a patient with COVID. And if you take that whole kit and we say, okay, well, how effective is that? Well, we know that it can actually decrease the risk of healthcare workers to about maybe just 10% of the original risk. So now instead of 4X, we're at 0.4X. Mm-hmm. So we're somewhere between 0.4 to 1.2X. So somewhere around what the general public risk is. Okay? Now you say, okay, well, what if that applies to healthcare workers? Why don't we just do that to the public? Well, if you look at masks alone, you need to know how to choose a mask. You need to know how to put on a mask. You need to know how to take off a mask. And believe it or not, it's not that simple. I've seen people walking the streets of Montreal, and the masks are on their neck.
Yeah.
The masks are covering their mouth, but not their nose.
Yeah.
The masks are on their forehead. This is not a proper use of masks. This is a ridiculous use of masks. So the effectiveness of masks in public is compromised because people don't know how to use the mask properly. But let's say people did know how to use the mask properly. They're not using the rest of the kit. They're not using the visor, the gown, the gloves, the hand washing, and most importantly, they're not in the close contact with a highly infectious person. But I would actually turn around. If people want to wear masks, if people want to wear the protective kit, come join us on the front lines because we're overworked. Yeah. But if you're not willing to step up to the front line, then leave the personal protective equipment to the people who are.
Dr. Vihn, I sensed some emotion there, and you'd said at one point that you've been faced with a situation where you didn't have the equipment that you needed. When that happens, what do? You
know what happens? You have to go find a mask. And that means that the patient has to wait for the patient who has symptoms, who needs to be evaluated, who may not even have COVID, may have another problem, needs to wait longer to be seen.
All right, we are back with Dr. Don Vihn, MUHC infectious disease specialist. Doctor, let's try and get a whole bunch of questions in here as quickly as possible, try and answer some things. First off, Dr. Vihn, I'm a senior in isolation. I was wondering if it's okay for my grandkids to play or walk my toy poodle for me. I'm not getting within 2 meters of my grandkids. They play with the dog. They take it for a walk. They bring it back. The handoff happens in a driveway. What say you?
Again, what we need to do, what we need to really emphasize here is that we need to minimize, these close distance interactions as much as possible. If I would actually try to suggest that maybe you can let your dog run out in the backyard if that's possible. Time to a leash if you think he's going to run away or he or she's going to run away, and maybe try to run around in the backyard if that's possible. If you have, for whatever reason, an absolute need that your dog needs to be walked, then you have to make sure that and somebody has to do it for you because you can't do it yourself, then you really need to make sure that you enforce those measures, that you are keeping 2 meters at least from anybody else, that there's a good amount of hand washing that's going on, and don't forget that, when you're passing on a leash from one person to another, that's also a means of transmission, what we call indirect contact. So if somebody has contaminated hands and they're touching your leash and then you touch a leash afterwards, you're also at risk for so again, good hand washing and good wipe down if that's your only option.
All right. Another question here from Lionel. Hi, Dr. Vihn. I'm having an engagement. I'm just kidding. That was. Let's go to the phone lines. Louise in Côte Saint Luc. Hi, Louise.
Hi.
What's your question?
I live on the top floor of a high-rise, and our building has been very proactive about no gatherings and nothing like that sort. And we're very careful, my husband and I. But I was wondering about when we take the elevator, our son-in-law in LA is making us crazy that we could be encountering air that's been contaminated. Is that so? Is that a way that we can get it? Because our building only allows 2 people in the elevator at once. So we've been only going in it, my husband and I. But
right.
Can we?
Okay, so I'm glad that you mentioned the first point about the gatherings. That really needs to be, any intentional or accidental gatherings need to really be aborted. Going back to your situation with the elevator, I doubt that there's a gathering in the elevator if it's just you and your husband. The air doesn't actually stagnate in elevators. Right? There's actually circulation of air, not just when the doors open and close, but as the elevator moves up and down the shaft. And the major concern is not necessarily the air, but just being careful with the buttons that you have to touch. So it's the manual touches, right? The button to press the elevator, the button to call your floor that you want. In those situations, you could be a little bit vigilant. If you wash your hands regularly, for example, as soon as if you're taking the elevator to go home and you wash your hands as soon as you go home, that should be sufficient. But if you're worried, okay, then you can use like an intermediate device, like you can use the sleeve of your jacket, or you can use like a glove.
I use my key. I use the tip of my key.
Fair enough. That's good.
And I don't touch anything, my husband either, and we only go in the elevator once a day to go for our walk.
Right. Well, the elevator is probably not a hotbed of like brewing virus.
Okay. Thank you. I was really concerned about that after and about our clothing on our when we come in after going to a grocery store. He said we should wash all our clothing and not bring it in the house.
Well, first of all, I'm not sure how feasible that is for the majority of people, and second of all, I'm not sure how much exposure you think that's happening at the grocery store. You know, if everyone's keeping 2 meters apart from everybody else, you shouldn't have any significant amount of respiratory secretions on your clothes.
Yeah, I didn't think yours either. Yeah. All right. Thank you.
Okay. Stay safe, Louise. Thank you very much for the call. On the text line, Doctor, Dr. Vihn, does the COVID test only reveal whether you have the virus or not? Does the test also reveal whether you had the virus and have recovered? This is from Lou in Villeray.
Okay, that's a good question. So the current tests that are available pretty much throughout the world that are being used currently are a molecular test to look for the genetic imprint of the virus, what we call the nucleic acid. So the virus is made up of a cousin of DNA. It's called RNA, and the tests that are currently available now look for RNA. So if the test is positive, that means that there's a virus genetic material there. Okay, so that means you are infected. It doesn't tell you whether you've had the infection in the past. Those are different kinds of tests, and those ones are not rolled out yet.
Gotcha. Okay, let's go to another question on the text line, and it has to do with 2.5 pH water. Being asked here if it can be used as a disinfectant. Do you know what that's about, Doctor?
If it's water that's acidic, that's with a pH of 2.5, I think if I'm understanding that right, the question is, can acidic water be used to disinfect?
Yeah.
And I have to tell you, I'm not the chemistry person here. I'm not sure. I believe that it could be, but even less drastic than that is just regular water with soap. Regular water with soap is great. In fact, there have been studies that more often you clean your household. Okay, that's at least for let's say the SARS epidemic that occurred. People who clean their household often, so as much as 11 times a day, had lower rates of infection. Probably because they were maybe bringing in transient levels at that time. So if you want to wash your property, soap and water is fine. I don't think you need any type of magical soap or magical water.
Okay, let's go to the lines and Sally in NDG. Hi, Sally.
Hi. I was wondering, Dr. Vihn, for those of us who are elderly and have a compromised immune system, who are really most at risk, in particular, even at losing our lives if we contact this, wouldn't it be wise, and I understand and appreciate as well that there's an incredible shortage of personal protective equipment, but wouldn't it be wise in future or to keep in mind that if we had that protective equipment, it would help save our lives?
It would. So I understand what you're saying. If you had that mask, would it provide you a benefit?
Not just
and
the mask.
The answer is it may provide some people a marginal benefit, but it's not like sort of a heal-all for everybody, right? What's going to protect you is staying away from people who are sick. So those masks are helpful if you have symptoms, and it minimizes the people. So for people who have symptoms, it minimizes the transmission or the spread to other people. But if you have symptoms, a mask is not the solution. The solution is to stay home, stay away from other people. On the other hand, you're on the receiving end, right? You're a person who's considered at risk, and what should you do? What you should do, more protective than a mask, is to stay away from other people. That's the best thing. If you're not around other people as much as possible, you will decrease your risk much more effectively than a mask, especially because masks are not being used properly. Right? Like I said, not only they're not positioned properly, they're being kept on way too long beyond the lifespan of a mask. There are certain quality parameters that have to be maintained for that mask to be effective, and wearing it in public for hours at a time or days at a time, that's just compromising a mask. Essentially, it's like the equivalent of wearing a scarf on your face. So if you are worried, then you need to make sure that you enforce all the other measures: distancing, hand washing, and good respiratory hygiene. In fact, if there's anybody who thinks they have a runny nose or sore throat or a cough, don't invite them.
All right. Thank you very much for the question, Sally. One last quick one with Joy. Joy, quickly, what's the question?
Hi, good morning. My question is that now there's new research has come out that are other symptoms such as chills, such as diarrhea, such as, things like that, and you might have the virus. How would you be able to test for that if, in fact, you think you might have it?
Right. So, yes, you are absolutely right. So in addition to the fever or the cough or, the breathlessness or having trouble breathing, there are new symptoms. So diarrhea is one of them.
But
we
that's
actually know from other countries that the virus can be found in the stool, which is why, again, if you have these symptoms and you have to share bathrooms with other people, one of the things you need to be doing is disinfecting the bathroom after use. But if you have new diarrhea, so you're not a person who has a chronic gastrointestinal illness, if you have new diarrhea in these times, it could be a sign of COVID. You should still get tested because it can be detected often, even if you have diarrheal symptoms, in the nose passageway.
All right. Thank you so much for the question, Joy. Dr. Vihn, you're a star. Thank you so much for coming on the program.
Thank you.